Good day, everyone. Today, we will explore the system development life cycle in nursing informatics. Our presentation focuses on how the nurses help build better health information system to improve patient care. This presentation will be presented by Marquez Postrano, Gabriel Anas, and Azure Ezra Formoso from the Graduate School of Nursing at St. Paul University, Philippines. Imagine walking into a patient's room. The monitor is alarm fatigue. The electronic health record requires 15 clicks just to document a single vital sign, and the barcode scanner won't read the medication wrap. Every single piece of technology in that room was built to help save lives, but without the right design, it can feel like it's just getting in the way of saving lives. We aren't just talking about software engineering, computers, or coding. We are talking about the Systems Development Life Cycle, or SDLC, the blueprint for how healthcare technology is born, built, and brought to the bedside. But the blueprint is useless if the architect doesn't talk to the person living in the house. Or in healthcare, engineers know software, but nurses know care. When technology fails in an office, a spreadsheet crashes. When technology fails in the hospital, patient safety is compromised. Nurses are the ultimate bridge between technical logic and clinical reality. Today, we will discuss how systems are developed and why technology cannot succeed in healthcare without a clinical voice of nursing at every single stage. Nursing informatics is a specialty that merges nursing science with information science and computer technology. It focuses on how data, information, and knowledge are managed and communicated in nursing practice. Nursing informatics matters because it improves the quality of patient care by enhancing documentation accuracy, communication efficacy, and clinical decision making. It also helps nurses to work more efficiently by reducing manual tasks, preventing errors, and supporting evidence-based practice. The System Development Life Cycle, or SDLC, is a structured step-by-step process used to create or improve information system. It ensures that systems are carefully planned, designed, built, tested, implemented, and maintained. SDLC prevents rush or poorly designed system by requiring each phase to be completed before moving to the next. This helps organizations avoid costly mistakes, workflow disruptions, and user dissatisfaction. SDLC is especially important in healthcare because clinical environments are complex and high risk. System must fit nursing workflow to avoid delays, confusions, or errors. When SDLC is followed, systems are more likely to support safe patient care, reduce documentation errors, and improve communication among healthcare teams. Nurses' involvement is essential because nurses understand real-world clinical needs, patient safety concerns, and workflow challenges. Without nurse input, system may be technically functional, but impractical or unsafe in daily use. The phases of SDLC take on a specific meaning when it applied to the field of nursing informatics. Here's how each phase translates to the development of information systems for nurses and patient care. Phase 1 is planning and analysis. This phase focuses on understanding the problem and determining what the system needs to accomplish. It involves gathering information from users, especially nurses, about current workflow challenges. Examples include slow documentation processes, frequent medication errors, or communication gaps between departments. The team analyzes these issues to determine what features or improvement the new system should include. This phase requires collaboration between nurses, unit managers, IT staff, and informaticists to ensure the system addresses real clinical needs. Now I will invite Mr. Gab Anas to present the next slide.
Thank you, Mark. In the design phase, the system structure and appearance are planned. This includes creating screen layouts, workflow diagrams, forms, alerts, and documentation templates. The design must be intuitive and user-friendly because nurses often work in fast-paced environments where confusing interfaces can lead to errors. Designers consider how nurses will interact with the system, what information they need quickly, and how to minimize unnecessary clicks or steps. A well-designed system improves efficiency, reduces frustration, and supports safe patient care. Phase 3, development and testing. During the development, programmers build the system based on the approved design. This is where the technical work happens: the coding, database creation, interface building, and the integration of the other hospital system. Testing is critical because it identifies bugs, errors, and mismatches between the system and actual nursing workflow. Nurses participate in usability testing to ensure the system works correctly in real clinical situations. Testing helps prevent problems from the system before the system is launched, reducing risk and improving user satisfaction. Implementation and training. Phase 4. Implementation is the rollout of the system into the healthcare environment. This phase includes installing the system, migrating data, and preparing the staff for the transition. Training is essential because even the best designed system will fail if users do not understand how to use it. Training may include hands-on sessions, user guides, demonstrations, and support from super users or informatics nurses. Successful implementation depends on the staff readiness, leadership support, and ongoing assistance during the transition period. Phase 5, maintenance and evaluation. SDLC does not end once the system is launched. Maintenance ensures the system continues to function properly by fixing issues, updating features, and responding to users' feedback. Evaluation measures how well the system supports workflow, reduces errors, and improves patient care. Metrics such as user satisfaction, documentation speed, and error rates help determine whether system is effective. Continuous improvement ensures the system remains relevant and useful as the clinical needs evolve.
Hi, I'm Asher Formoso. I'll be presenting the role of nurses in system development life cycle. The nurses play a vital role in system development life cycle by ensuring healthcare technologies meet clinical needs, improve patient safety, and supporting efficient workflow. Rather than being passive user, nurses are active partners throughout the development and implementation of health information system such as electronic health records, clinical decision support system, telehealth platforms, and barcode medication administration. The role of nurses in SDLC is to identify workflow problems, providing design feedbacks, participating in testing, training and supporting peers, reporting issue and enhancement. Why nurses are important? Nurses are primary user of healthcare information system and they spend more time with patients. Their involvement help ensure that systems are patient-centered, clinically accurate, easy use, efficient, and safe. Nurses are active partner, not just end users. Nurses should be involved in every system development lifecycle phase, including planning, analysis, design, development, testing, implementation, and maintenance, and evaluation. So nurses contribute critical expertise throughout the SDLC process. Their participation helped create healthcare technologies that improve patient safety, enhance workflow efficiency, support evidence-based practice, and ultimately deliver high-quality, patient-centered care. Barcode Medication Administration (BCMA) is a healthcare technology that uses barcode scanning to ensure the right patients receive the right medication, right dose, right route, and time, help reduce medication errors, and improve patient safety. Phase 1 Conceptualization and Build. Planning and design to identify medication administration problem and workflow insufficiencies. Define system requirements and patient safety goals. Determine necessary hardware and software. Nurses provides insight into medication errors, documentation, challenges, and workflows issues. Interface development. Develop barcode scanning and medication verification screen. Integrate BCMA with electronic healthcare records. Configure alerts and medication databases. Nurses review usability, navigation, and workflow compatibility. The Phase 2 Validation and Development. We have testing and training to test the barcode accuracy alert, workflow processes, and system integration. The nurses participate in testing and identifying safety risks or software issues. Staff receive training on scanning medication, patient identification, and responding to alerts. The results are safe and effective system used before rollout. And we have the implementation and maintenance. Deploy the BCMA system in clinic setting. Monitor performance and provide ongoing updates and support. Nurses reports technical issue, workflow concerns, and opportunity for improvement. It's a continuous system optimization and improved patient safety. The role nurses throughout SDLC, the planning, development, testing, training, implementation, and maintenance. There are a lot of benefits of the BCMA, one of which are reduces medication errors, enhances patient safety, improve medication accuracy, increase workflow efficiency, automates documentation, support regulatory compliance. So the SDLC ensure that the BCMA system are carefully planned, developed, tested, implemented, and maintained. Nurses play a critical role throughout the process in helping create safe, efficient, and patient-centered medication administration system that improve healthcare quality and patient outcome. SDLC benefits and challenges in healthcare. The system development lifecycle provides a structured framework for developing and implementing healthcare information systems such as electronic health records, barcode medication administration, and clinical decision support system. When applied effectively, SDLC improve healthcare quality, patient safety, and operational efficiency. This is the improve accuracy and completeness of the patient record, reduce documentation errors, provide quick access to patient information, support legal and regulatory compliance, safer patient care, reduces medication and treatment errors, improve patient identification and clinical decision making, support patient safety through system testing and validation, improve communication. It enhances information sharing among nurses, physicians, pharmacists, and other healthcare professionals. Reduces communication delays and misunderstanding. It promotes coordinated patient care. More efficient in workflow. It automates routine tasks and reduces paperwork. It eliminates duplicate documentation, save time, and increase productivity along more focus on patient care. We have some challenges of LDLC. Staff may be hesitant to adopt new technologies and workflows. It can lead to slower implementation and reduce user acceptance. We need also more training requirements to the staff need education, hands-on training, and use new system effective, requires time and organizational resources. We have also technical issues for software bugs, network failure, and equipment malfunction can affect the performance. May interrupt also clinical workflow and impact patient care. One of which is also cost and time investment. The implementation requires significant financial resources for software hardware training and maintenance. Large healthcare project may take months or years to complete. Although healthcare organizations may face challenges during implementation, the benefits of LDL generally outweigh the difficulties when managed effectively. Successful SDLC implementation may lead to better documentation, improved patient safety, stronger communication, higher quality. SDLC is essential for developing safety, efficient, and reliable healthcare information system. By involving nurse and other healthcare professionals throughout the process, organizations can maximize system effectively, reduces implementation risk, and ultimately improve patient outcome and quality care. In conclusion, the SDLC system development lifecycle provides a structured approach to developing and implementing health information system. It helps ensure that healthcare technologies are safe for patients and healthcare providers, efficient in supporting clinical workflows, aligned with nursing practice and patient care needs. Nursing information combines nursing knowledge, science, and technology to improve healthcare delivery. Nurses play an important role throughout the SDLC by identifying clinical needs, providing feedbacks during system design, participating in testing and implementation, evaluating system effective after deployment. Nurses are active contributors, not just end user in development of healthcare technologies. Effective collaboration between nurses and IT professionals can lead to improved patient safety, better communication, enhanced documentation, more efficient workflows. Nursing informatics empowers nurses to influence and shape healthcare technology, ensuring that health information systems support safe, efficient, and patient-centered care. Thank you very much.